Hi there. So for this scenario, I will be assessing the cognition of a patient that is under the influence of alcohol and drugs. The term competency is used to describe the ability of a patient to be able to make an informed decision regarding their healthcare. A competent patient has the right to make informed decisions and refuse treatments, including life-saving treatments. A patient is presumed to be competent to make informed decisions unless there are reasonable grounds for believing the patient is not competent. The first being appears to be unable to understand information, or appears to unable to understand the consequences of their decisions, or appears to be unable to remember the information. Another could be a belief the risks associated with providing the treatment are less than the risk of not providing the treatment. And 5, the treatment is not contraindicating the valid advance directive. So for this scenario, I have been called out to a drunk patient who has his mates have called because he's fallen over and has done damage to his hand. Okay, so here we go. Hi there, my name's Angus. I'm a student paramedic. What seems to be the problem today?
Oh man, just had like a big night out with boys and my finger's a bit sore, done some damage.
Yeah, so you're saying that the sorest part of your body right now is your hand here?
Yeah, bro, yeah.
Can I have a look at your hand if that's all right, mate?
Yeah, mate.
So, see here the obvious signs of fracture. So this means that we can't do too much here other than give him pain relief and look to transport him to hospital. Okay, mate. Because of that fracture, I believe that it'd be best to go to the hospital so we can get you an X-ray and get you further treatment from there. Is that all right with you if you guys come with us?
Oh man, I really don't want to, There's this like good ass looking chick that I've been like trying to get with all night, man. Do I have to? Can't you just like fix it here, do some magic or something, bro?
I'm afraid not. We probably have to look to go to the hospital. A few other things I'd like to ask you, Jonty, is that have you been drinking tonight?
Oh, just one or two, bro? Yeah. Just with the boys.
Just a couple of the boys.
YTB, bro. Yeah, the boys.
Any chance you've had anything other than alcohol, drugs?
Oh, man, I honestly couldn't tell you. It's just been an absolute epic night with the boys, Okay. Yeah.
In this scenario, I believe that the patient is incompetent to make an informed decision due to the possible drug influence and the obvious alcohol intoxication. I will now continue to ask further questions of what's happened tonight and advise him further to come to hospital with us. I will respect his choice if he decides to stay and continue on partying through the night, but as this choice could lead to further harm to him, I would really provide him the choice, of the risks that could happen tonight for him. Okay, Jonty, so you've had a couple of drinks, you might have had a few other things. Because of that hand looks pretty nasty, we want to get that X-ray going. Because I understand that the hospital can be slow and you want to keep partying tonight, but because of the risks that have shown that you could do potential further damage, and because of you being under the influence of alcohol, I would really like to take you to the hospital if that's okay.
Oh yeah, I suppose, man. You're the boss, man. You're in the uniform, bro.
Okay, great.
Yeah.
So Jonty has now decided to come with us to hospital to get that further X-ray on his hand, and that's awesome. Cheers.